hormones in sex. In regard to sex and reproduction, the most important endocrine glands are pituitary glands and the gonads of sex glands, testes in male and ovaries in female. The anterior pituitary gland secretes two gonadotropic hormones, follicle stimulating hormones FSH and luteinizing hormones LH. They play major roles in the function of male and female sexual functions. During pregnancy, placenta secretes human chorionic gonadotropic hormones that has the same property as LH. These hormones stimulate the interstitial cells of fetal testes and produce testosterone, which promote formation of male sexual organs. No testosterone is produced during childhood until the age of 10 to 13 years and lasts throughout the life. On stimulation of LH from anterior pituitary, testosterone is produced by the interstitial cells of lady is in the testes. Follicle stimulating hormone from anterior pituitary stimulates conversion of primary spermatocytes into secondary spermatocytes in the seminiferous tubules of testes. However, for complete formation of spermatozoa, testosterone is needed. Thus, follicle stimulating hormone initiate proliferative process of spermatogenesis and testosterone. Thus, the final maturation of spermatozoa. Testosterone secretion after puberty causes the penis, scrotum and testes to enlarge until the age of 20. Testosterone causes secondary sex characteristic of male. In female, the anterior pituitary produces gonadotropic hormones, FSH, follicle stimulating hormone, and LH, which act on ovaries and produce estrogen and progesterone. During the reproductive years, there is monthly rhythmic change in the rate of secretion of female hormones and corresponding changes in the ovaries and sexual organs. The rhythmic pattern called as the menstrual cycle is of 28 days. Variation from 20 days to 36 days is taken as a normal. At the age of about 8, the anterior pituitary begins secreting gonadotropic hormones, FSH, LH. These act on ovaries. One of the follicles grows and ovulation takes place on the 14th day, counting from the first day of menstruation. During the growth of the follicle, estrogen is secreted. Following ovulation, the follicle develops into corpus luteum that secretes the progesterone hormone. After 2 weeks, the corpus luteum degenerates. The ovarian hormones, estrogen and progesterone decrease greatly and menstruation begins. Estrogen is responsible for secondary sex character of the female. Progesterone is concerned with the final preparations of uterus for pregnancy and the breast for lactation. Male's capacity to be stimulated sexually shows a marked increase with the approach of adolescence. The frequencies of responses to the point of orgasm reach the peak within 3 or 4 years after the onset of adolescence. Frequencies of sexual response in the male begin to decline after early 30s and drop steadily into the old age. Among females, the median frequencies of sexual activities remain constant from late teen into the 50s and 60s. In females, the maximum incidence of sexual response are not approached until sometime in the late 20s and in 30s. Individuals who are physically exhausted or in ill health are not easily aroused sexually. If aroused, they may not be capable of effective action and may fail to reach orgasm. Estrogen occurs in equal amount in pre-adolescent female and male, but at the time of adolescence, estrogen increases abruptly in female. At the onset of adolescence, there is no absence of sexual activity